Warm welcome to another episode of the Univen TV. My name is Vhuhwavho Makhaga, and today we are here at the University of Venda Stadium, whereby there is an End TB campaign for 2025. The National Department of Health is here, is actually supporting the event together with the University of Venda. Right here, I'm actually joined by someone who's very familiar to University of Venda students. But if you're not a University of Venda student, you will get to know her. I have Mrs. Hlongwane with me, Ndimasiari, and welcome. Yeah, maybe if you can just give us a little bit of a background of the event, the campaign that's happening today. What can you tell us?
Okay, thank you so much. My name is Sister Hlongwane, the HIV coordinator at University of Venda. #Zikhala Kanjani. What is happening here? We are having the campaign, the End TB campaign, together with the National Department of Health, the Pompo Province Department of Health, and our district Department of Health. Here we are. What we are doing, we are having the campaign, which comes after the announcement of 5.5 million people that are having TB and they are lost to follow up, or including the 1.1 million people that are having HIV, they are defaulters, and then they are lost to follow up. So what we are doing currently here, we are having our session wherein we are going to do dialogue session. We're doing the information giving through different topics, including TB, HIV. Since we know that is a mental health month, also we're going to talk about mental health, and then we'll be talking about GBV. And then we do have our ambassadors, which these are the people that suffered from TB and GBV. They will be telling us the reality of how do you feel after experiencing such things. And they will be giving out the information to the people, because our aim is to end TB, no longer to treat it like we have to remain with it, but we are coming up with the strategies that we can use to end the TB.
Yeah, here you're talking about Zikhala Kanjani campaign. We're very familiar with that one as Univen students. But I also heard you, also the people that are in the program right now, they're talking about HIV. If you can tell us maybe, just a little bit of intel as to what is the connection between tuberculosis and HIV?
Thank you so much. The collaboration between HIV and TB, the issue is when one is HIV positive, as we know that HIV, it lowers the immune system. And then once the immune system is low, you are at risk of contracting this other TB. So people that are HIV positive, they are at risk of having TB. That's the reason why we cannot talk about TB and then we don't talk about HIV, or we talk about HIV and we exclude the TB. So a person who's HIV positive will also supposed to be screened for TB. If he or she is not having TB, we give the prophylaxis to prevent TB, because that person is at high risk since the immune system is compromised.
Yeah, you're talking about compromising that's happening in between. So if we're to talk about, the testing of TB and also HIV, how do these two things, affect each other, looking into the testing issues and also the strategies that you use for treatment?
Okay, thank you. What's happening when we do our screening? The issue is during our campaigns, yes, we can call it, we are doing the HCT, which is the counseling, HIV counseling and testing, but we don't exclude the issue of screening for TB. So when we are doing the screening for HIV, we also screen for TB in a manner where we ask you several questions like, are you coughing for 2 months, for more than 2 weeks? Where are you having night sweat? Are you having fatigue? Are you having loss of weight? Where in now you're loss of weight, you are not doing anything to contribute to your loss of weight. So we also screen for you. If you have the signs and symptoms, 3 or more signs and symptoms of the ones that I've mentioned, then now we also collect the sputum for gene expect to screen you for TB. If now they come negative, it means now you don't have negative. It might be other things that can be contributing to the signs and symptoms, that like one who's having diabetes or maybe flu. Then if now we screen you and then we collect your sputum and it comes positive, then we start you on medication.
Yeah. So looking specifically at the hashtag and TB campaign from 2025, we talked about the fact that, the issue is not to only treat TB, but to actually end TB. Let's look at other goals. What are other goals that you have with regards to this campaign?
Exactly. the other goals that we are having, this campaign is not like one thing is the thing that is supposed to continue until like we reach the number like 5.5 nationally. TB is a airborne disease, so it's easily transmittable to other people. So we are having the challenge that we did have people that were on treatment, and since the COVID, people they just disappeared, and people they change their numbers. So we'll be continuing screening like we do. Our screening for TB is a daily thing, even in our clinic. When you come there, we don't exclude that, but we include that. We do have our strategies of screening that. So the goal is for us to reach each and everyone. In our campus here, we are targeting our students, we are targeting our staff members, because out there at the community, during the day, they are not there to can get the services. So we are rendering the services here on campus. So after today, we're still continuing doing the screening for TB so that we can contribute to the end of TB. We are not targeting at TB. Remember the 1.1 million of people that are HIV positive that are not on treatment. Some of them, they were on treatment, and some of them, they were not yet started on treatment. They are out there. And then the reason why this campaign, we call it the closed gap campaign, so that the infection mustn't continue to replicate. We have to locate those people wherever they are, and then we restart them on treatment.
Yeah. When we talk about the University of Venda, we're talking about a place that's actually filled with young people. Looking at, your perspective as someone who worked with these people on a daily basis, what role do you think the students can actually play as young people right now in actually raising awareness about tuberculosis and HIV, and also breaking down the stigma that actually still exists around these issues?
Okay, what we are expecting with our students, we expect them to cooperate with us. Like since we are having our peer educators, we expect them to go to different races, giving out the information. And the other issue is we're pleading our students to say, if you see somebody who's coughing, you see your colleague, your peer who's not feeling well, refer them for medical assistance so that we can do the regular screenings, and then we assist them before they mess up with other people. The other issue is we are pleading to our young one, more especially the 18 to 24, which are universities, including our varsities, because these are the people that are sexually active and they are still exploring, they fear nothing. So our plea is that for them to use preventive measures to prevent the spread of infection, the use of condom, and then being faithful with one partner, which is very, very important. And the other issue, the use of PrEP, because we do have the PrEP in campus to prevent the spread of HIV infection. So what we are saying to say to our students, come with your partner, come with your friend to our station, get your test, and then you must know each other status. Like we're saying, zikhala kanjani, zingakhali without knowing each other's status, zingakhali without taking your ARVs.
Yeah. But another issue that I mentioned is the issue of the stigma that still surrounds, these things, HIV and etc. I mean, what is it that you can say to, your students that are watching at home, the communities that are watching at home? What is it that we can do to tackle the shame and the stigma that still surrounds these issues?
Okay, thank you. Yes, we understand these two issues, HIV and TB, another condition, of course, the stigma attached. What we are saying to people, first thing first, consider your health. Yes, people, they will talk and then they will try to put pressure upon you, but it's very, very important to go to the clinic. It's not important. It's not the issue of necessarily telling people, this is what I'm suffering from. But when you come to us as health professionals, remember, confidentiality. We don't share your information. Come and then you partner with us. We are there to support you. We do give people our number so that if now you're feeling the pressure or you are not comfortable, so that you can communicate with us until you finish your medication. If it's TB, if it's HIV, we are there to give you your support throughout. And we do have like different hotlines where now you can talk to different people that are not around yet can assist you. So you come to our clinic, then we'll assist you.
Yeah, Ms. I think that's all we're going to have to cover for today. But lastly, to your students, your Kalaranjani people, what is it that you can say with regards to the campaign and, just staying safe in general?
Okay, what I'm saying now, we are saying we're pleading to the student. Please come to the stadium currently and get the information. We have got different professionals here, like the experts. They are here today. come and get a lot of information with us. And then what we are saying to you as our student, hashtag zikhala kanjani without using your condom, zikhala kanjani without taking your PrEP, zikhala kanjani without taking your oral, your contraceptives, zikhala kanjani ungokho grand mentally, zikhala hashtag zikhala kanjani.
Hashtag azingeke sikhali without protection. Thank you. We are now joined by the National Department of Health spokesperson, Mr. Foster Mohale. Mr. Mohale and Masiari, and welcome to the University of Venda.
The Masiari Woti ki je chifenga cheki wedise ba checheri ba Univen FM.
Okay, this is the University of Venda podcast. So we are here and you guys are hosting the hashtag and TB campaign for 2025. If you could briefly share with our audience, what is the background of the End TB campaign for 2025?
The background of NTB campaign was necessitated by the high burden of TB in terms of mortality and morbidity. Mortality simply means the rate of the deaths caused by TB, which is a preventable and manageable disease. Morbidity simply means people, the rate of sickness through TB infections in the country, because TB is one of the most underestimated disease, which is the leading cause of death not only in South Africa but across the world. So people don't take TB seriously like the way they take other diseases like your COVID-19, your HIV, your diabetes, your hypertension. So TB is the leading cause of death, and we call it death. It's a silent killer, unlike it's like a slow poison. So that's why, as the government, we've launched an TB campaign in order to reduce deaths associated with TB, in order to raise awareness about dangers, the signs and symptoms, and also the mortality rate, so that people must wake up and also start taking TB treatment, TB seriously, so that when we say people must regularly screen and test for TB, must take us serious. They must not wait to fall sick first, then start coming to us, say, please, we want to screen and test for TB and other conditions.
Yeah, you think that it's considered a silent killer. Maybe if research has been made, what is it that you guys are finding out? Why is it that people don't take TB as seriously?
The reason why people don't take TB seriously is precisely because of the fact that I mentioned that it's a slow killer, like a slow poison, unlike other diseases like COVID-19, because once they say there's a new COVID-19 variant, people, they wake up, they get worried, and the level of anxiety will go up. But with the TB, you can still live with the TB symptoms on a long term, but without getting worried about the treatment. But also, the other thing is the issue of stigma. TB is associated with poverty, and also there's a high rate of stigma associated with TB. That's why even the people who are diagnosed with TB, they get discouraged to continue with treatment because they get discriminated against, especially in the communities, in the family. So this is one of the challenges that we need to confront as the society in order to encourage people living with TB. And people, they don't know that one person living with TB can infect at least 15 people. So you can imagine, 2 people living with TB can each infect 15 people, mean that 30. If me and you, we are living with TB, we don't take treatment, I can infect 15 people, you can infect 15 people. Our 15 people each can infect 15 people. So TB spreads faster than most of the conditions. So, and the only way we can stop the spread of TB is to go to health facilities, the clinics, hospitals, or even in the services like this, just go and screen, so that if we detect TB early, we can be able to put you on treatment, so that you can continue to live a long and healthy life, just like anybody.
Yeah. Okay. So, how is the End TB campaign for 2025? How does it align with the department's broader long-term efforts to actually eliminate TB in South Africa? Let's talk about specific goals or strategies that are actually in place for that phenomenon.
Look, our goals, our long-term goal, which is aligned with the goals of the World Health Organization, is to end TB by at least 2035, which is about 2035 is about 10 years from now. We've got a long journey to go, but if we join hands with the government, civil society, institutions of higher learning like Univen, we need more ambassadors to assist us to preach a gospel about TB. But for us to arrive there at 2035 to reach that number, we first need to we have to set ourselves an annual target. The annual target is to screen at least 5 million people every year for TB and diagnose at least 235,000 people on a yearly basis, because there are a lot of people who are living with TB. Some of them, TB, if you are living with TB, you may not see the signs and symptoms, but if you happen to catch flu or you live with HIV, your immune system will be complicated. You can face serious health complications. So our target is to at least screen at least 5 million people every year. That's our target, an annual target. So we are working very hard. We want to also urge students, listeners of your radio stations to say, please, if you know that your loved one, your committee member is living with TB, encourage them. The more you encourage them to take treatment, adhere to treatment, is the more you are also trying to save yourself and other community members. Because if you discriminate against me, I don't take treatment, it means I'm putting everyone at risk.
Yeah. Let's look at the current national statistics and trends. Are there signs of improvement, or are there any specific areas that, still require urgent intervention?
Yeah, there are what you call the high burden areas in the target audience. Those they include mining communities. Yes, the TB prevalence is high around the mining communities, precisely because of the miners. Because the miners where they are, there's no windows inside the mines, meaning that it circulate among the workers, especially when they go and work in the shaft underground. So that's why the mining communities and also the communities around the mining sector, around the mining areas, they are at a higher risk of contracting TB, but also healthcare workers who are treating patients with TB, because TB spreads airborne disease, meaning that you can catch it if I cough, if I sneeze, without covering the mouth, without covering the nose. And so we always encourage people to say, as part of etiquette, try by all means to regularly cover your mouth, cover your nose when you sneeze, when you cough. That's where you will be able to stop the spread of this preventable and manageable disease, because we do have a treatment.
Yeah. So one of the notable aspects of the campaign is, inclusion of mental health. One would ask, what is the link between tuberculosis and also mental health, and how is this year campaign, addressing the connection between these two things?
There's a serious connection between TB and mental health. Is the issue of stigma. That's why we always say people, they need to break their silence. The mental health is contributed by the fact of that people who get stigmatized. Obviously, when you get stigmatized, number one, you will not be free to go and take treatment. The more you don't take them, the more you don't get support from the family, from the community. You suffer from stress, you suffer from depression and anxiety. That are part of that are symptoms of mental health. That's why we say, please break your silence so that we can get help. There's no need. It does not assist for you to die silently while we have got the treatment, while we've got the psychosocial support in order to encourage you to feel that you are cared of, you are loved, you are supported by the community, so that we can try to break this silence and also address the issue of mental health, which is a serious problem in the country.
Yeah. You also talked about, the stigmas that still exist, the stereotypes. What are some of the challenges that as the department you're still facing, with regards to reducing the stigmas and the stereotypes associated with TB, and how is this campaign aiming, to shift the focus or the public's attitude towards TB?
Yeah, no, definitely. That's why we work here with a number of partners. Some of them, they work in the space of psychosocial support, like we work with your Lifeline, which also plays a role in terms of psycho support, social support, in order to encourage those who are not free to break silence, who are not able to talk to someone else. You feel dejected, rejected by the community, by your loved ones, your colleagues, your classmates, to say, please, there's a number that you need to call. I'll get you the number from Lifeline, where you can just call. You will be assisted by qualified psychologists, social workers in your quiet space where you'll be able to talk. And that service is available in all official languages. So the issue of language barrier should not be a problem, because if you happen to call and the first person who answer your call cannot speak your language, at least they can transfer you to someone who can speak your language, so that you feel free to express yourself.
Yeah. If we were to take it back, to my childhood times, there was a little advert that would play on TV, and I think there was little kids, very young kids, and then at the end they say, "We beat TB."
Yes.
I used to love that advert. But then, as the department, if we were to look back at how far we've actually come with TB, what are some of your proud moments and proud achievements that we've so far reached as a country?
Yeah. Around 2010, we launched, this is one of campaigns that we launched, because sometimes a campaign cannot last longer, more than 5 years, because obviously it can give you can achieve your desired outcomes within 1 or 2 years. Then the message get tired.
Yeah.
So we need to review the messages. So one of them, we also launched a mass screening TB. I think the target was to reach about 10 million people with screening with that campaign. And we have exceeded the number that we set ourselves. So that's why we say, want to appeal to members of society, private sector, civil society, institution of higher learning, to say, please join hands with government in this campaign in order to save the lives of South Africans. Some of them is the issue of treatment. Say the more prevention is better than a cure. And we say early detection. The earlier we diagnose you, the better, so that you don't stay long in the treatment. Because if we find that by the time we diagnose you, already we're at a higher stage of TB, then that's going to be a challenge. That's why most people, they end up breaking the chain of treatment, because it may take longer. So as we say, early detection saves lives. Go and screen and test for TB anytime. Don't wait to get sick. Don't wait to get signs and symptoms. If you experience any of the signs and symptoms, like you feel losing weight, even knowing that you are not exercising, you are not on diet, and you can't explain the reasons of you losing weight, well, that could be one of the signs and symptoms of TB. Sweating at night without understanding what is the cause of sweat, please just go to the nearest health facility and screen for TB. That could be one of the signs and symptoms of TB.
Yeah. I think some of the challenges, or one of the challenges rather, that we experience as a country are issues that are actually coming from, these health facilities, and the stereotypes actually emerge from some of the health workers. In closing, what is it that you can say to the health workers to assist you, to assist each other in the #EndTB campaign, and also to the people in general about this issue?
Yeah, now the issue of healthcare workers, there are a lot of reports where people say the attitude of some of our healthcare workers also deter them from going to health facilities to screen and test for TB. We can't say no, and we also, when we say it's not all of them, of course, we may find that in a bag of potato, 1 or 2 potatoes are rotten, and will not allow that to disrupt our service delivery. That's why other provinces, like your province of Gauteng, they launched a campaign called Saving with Smile, encouraging our healthcare workers to serve with smile whenever they assist the healthcare users, the patients, so that they must feel welcomed, they must not be scared, they must not be discriminated against. Sometimes we get the reports that when people they go to health facilities, you will hear a nurse shout to say, those who are sick of TB must come this side, HIV must come this side, diabetes must come. That is one of the contributing factors that deter the people from seeking healthcare. Because you can imagine when they start, you are in one queue, say TB this side, HIV this side. So automatically you are discriminating against. No one, your health status is you need to keep. Your health status is your business. So you're not forced to disclose your health status to anybody except to healthcare worker who's supposed to do that. So, and no one has got the right to disclose your health status. But we say we need to respect the privacy of our healthcare workers when they come to our clinics and hospitals, because they trust us. They trust us as our healthcare workers that we can be able to keep their health status to ourselves.
Yeah, Mr. Mohale, thank you so much. Uh, We are now joined by Mr. Silialia Marake, who is the Deputy Director for Advocacy and Communications under the Department of Health. Mr. Marake, welcome to the University of Venda.
No, thank you, my sister. I'm very pleased to be here.
Yeah, we are very happy that you were able to make it. But let's do a little bit of a dive in. Give us a brief overview of the TB End campaign for 2025.
All right. Maybe for me to give you a broader perspective of what is happening within the TB space, it will be important to take you further back slightly so that you can have, a brief history of what is happening. As you will know, the world experienced COVID-19 in 2020. As and when we were in preparation to commemorate our TB Day, which is normally on the 24th of March each and every year, the Deputy President during that week then announced the lockdowns for COVID. But now what happened then is that because people were now confined within their home spaces, majority of our people then started stopping with their treatment. People started stopping seeking other health services, including TB. Now, as the TB program, we then, experienced, the slow uptake in as far as the TB services are concerned. But then in 2021, having realized that, we were having more and more people who were lost to TB treatment, we then, as the National Department of Health, working together with the South African National AIDS Council and other key and relevant stakeholders, developed a strategy. That strategy was called the TB recovery plan. Under the TB recovery plan, the issue was exactly that, to recover lost ground in as far as getting more people to actually test for TB, for people to be channeled back into TB treatment, but then also to ensure that our people, do take their treatment to completion so that they can be healed at the end of the day. Now, subsequent to the TB recovery plan, which, by the way, had 5 key pillars. The first pillar was to communicate, advocate and communicate. The second pillar was to find, meaning finding people who may have TB. The third pillar was to link these people to care. But then the fourth pillar was to ensure that those who are linked to care do complete their treatment. And finally, to use data that we will have, gotten from the TB recovery plan to influence policy and decision making in the TB program going forward. Now, like I said, pillar 1 is about advocate and communicate. Now, to assist the End TB plan, which is the policy document of government nationally, we then developed the NTB campaign. The primary goal of NTB campaign is to reinforce the World Health Organization, WHO's plan to end TB in the world by 2030, specifically in South Africa, and to eliminate it by 2035. So that is a communications specific, intervention, where we are saying under the End TB campaign, we want to test and screen 5 million people by the end of this year. But then subsequent to that, the NTB campaign is a 3-year campaign, meaning each and every year we should have tested 5 million people. So that's where we are with this particular campaign. Now, for us to be here at the university is because we also have identified that, the challenges of TB, they transcend borders, meaning that they also affect students. And the student population, majority of the time, is the neglected group, which is very important in the TB program, particularly when you consider, the comorbidities that exist between HIV and TB, but then also between HIV and mental health, given the stresses that the student communities will actually, experience in their student, life or journey.
Yeah. Over the past years, we can actually agree to the fact that the department has been running several programs on, TB awareness and also prevention programs. Let's look at this current 2025 campaign. How would you say this current campaign built on, efforts and also lessons from the previous initiatives that you've had?
Yes, it certainly does. Because you will remember, as you are correctly saying, that the department is not new to this. Promotion of health is very eccentric, is very key to health program of the country, particularly to prevent disease. Now, the TB program, I think a few years back, we had what we call the Kick TB campaign, which was actually targeting specifically, learners in both high schools and primary school level. But then this one now builds from that to say, on top of that, let's now target specifically the youth between the ages of 16 to 24. And we're targeting the youth both in and out of school. But then for those in school now, hence we are here to target the students specifically to say, this is what we do.
Yeah.
But then to link it, I will say yes, as the department and government brought, because we are also working with other departments within the social cluster. We embark on a number of community outreach-driven initiatives, a number of campaigns, a number of events, a number of awareness and education campaigns that are happening. As we speak here, we have what we call the Close the Gap, campaign that is run from the end of the HIV, which is also, community-driven, but they also are going to institutions of higher learning, especially to get those patients who have actually stopped with their ARVs or HIV-related medication. We intend to bring them back to care. So this campaign basically is complementary, or should I say, both the two campaigns are complementing each other. But then over and above that, there are many that are running the Yoshi Caucus program that is looking at your girl child and many other similar campaigns. Yes, we as the department are doing much. But then it's also important to do this type of things because we are also using these campaigns to learn. It's a two-way type of communication.
Yeah.
As and when we are here, there are dialogues that are happening with the students. The intention for that is to make sure that we also learn from the student perspective as to what better, strategies or communication platforms and mechanisms that the department can use to actually, improve on the current communication strategies, but then also to amplify, the educative and health promotion aspects of it from, the beneficiaries of the services themselves.
Yeah.
So yes, there is a lot happening.
You talked about, the fact that one of the key goals is to end TB by 2035. You're saying that you guys want to be over and done with this entire thing. But at this point in time, these are some of the goals. But let's look at more goals. What are some of the key goals that you're trying to reach, that you're trying to achieve by this program?
Okay. This program has got many facets to it. The first facet that we spoke extensively on is basically to create awareness and education. The second component of it, which is now the key one, is to encourage screening and testing, particularly for the TB services. However, there is another, objective that we are pushing, which is actually to deal with issues of stigma mitigation. We know that stigma issues around issues of TB, HIV rise, particularly within the young people.
Yeah.
So we really want to end stigma that is there. But then over and above that, we understand fully that, majority of our students as Black people, you find that we are the first from our families to come to university.
Yeah.
That on its own come with what we call referral power, meaning that when you go back home, because now you are the most educated person, everybody will like to listen to your opinion, and your opinion counts and even influences their decision making. Not only your family, members, but then it extends even to your friends, friendship cycles. It extends also to communities. So we want to actually, create that a sense of stewardship amongst the student population. We want to actually develop students to become advocates of health issues so that they can be, an extension going into communities, educating their family members, friends, and communities about issues of TB, because we believe that they have power, not only limited to that. But then remember, we're talking about the generation which is technology savvy. They are very good with their gadgets. They use them. You know the power of social medias, which is what we call on-the-line communication, by the way.
Yeah.
So students, they are able to use that and share information, which then has the potential to actually penetrate our communities by way of, message dissemination and cascading from the people that the people can resonate with back at home, as opposed to me being an official of the department coming here and saying a whole lot of things like now. But, if you talk to people that you will know what power.
Yeah.
So people believe in that.
Yeah, that's absolutely beautiful. I just wanted to come to the issue that talk about, resonating with the communities or the people or the targeted group that you're trying to engage with. What are some of the ways do you think that, the students as the ones that are actually learning of the information right now at this point in time, they can actually use to actually engage not amongst themselves, but also the communities back at home?
Definitely. Hence, we said, we want to empower our students to become, better, community activists, to become the ambassadors of health programs, not only TB.
Yeah.
So we basically encourage students, to actually form, your educational groups, like your peer educator groups that are there already and on campus, but then also going back home to be to be the ones pushing for the formation of such. Remember, a student is not just a student here or a member of the institution, but then going back home, you are a member of a church.
Yeah.
You are a member of a sport club. You are a member of various other social formations. So we want you to actually carry the word, and lead within those spaces so that we can achieve, a TB-free, an HIV-free, a society by 2030.
Yeah. If we are to talk about South Africa as a whole, we can talk about different challenges, and we can actually, adhere to the fact that there are some communities that are more privileged than others looking into access to healthcare.
Yes.
For example, what strategies are the department, or rather is the department, using to make sure that this campaign reaches the people who need it the most, and also those who are not at, the leisure of having access to much needed healthcare?
Thank you. Maybe let me start by saying our conversation was limited more to students so far.
Yeah.
And I'm glad that you are bringing this aspect up.
Yeah.
You also are actually probing me to share the broader strategy to say, as the TB program, we have what we call our key populations. These are the people who are more likely to contract the TB disease. Now, we have people who are who are working in the mines. We have people who are incarcerated in correctional services.
Yeah.
We have people living in informal settlements. We have people who are living in high, density areas, including the mining towns.
Yeah.
Those people are most likely to have TB. However, because now TB affects everyone. Remember, TB is airborne. And therefore, it is, transformative. You can actually, it's infectious. You can infect one person with TB through inhaling in the air.
Yeah.
That being said, it means that we are actually targeting all segments of our population. We're targeting the affluent people. We're targeting people, the middle income earners. We're targeting also the low income earners.
Yeah.
By the way, in the low income earners, that's where, the proliferation of TB is higher. However, with those who are in the high income, brackets, we have other programs that we're running, like with the transport sector, where we're targeting like your airports. That's where these people are traveling and all. We are advancing, TB, but then we also are working with the civil society in all its sectors. And one of the sectors there is the business sector. Now, through the business sector, we're targeting businesses to be part of the solution in response to both HIV and TB in the country, but then also we're targeting the people who are working, including the owners of production. Those are your owners of these businesses. So having said that, the message that I'm trying to send out there is that TB affects everyone, and as such, we are targeting all people in our country to make sure that as South Africa we can be free from TB and also HIV at some point in time.
Yeah. There are mentions of HIV, it was just mentioned now, mentions of mental health issues that are being mentioned. One would ask as to what's really the connection between all these aspects, and, how is the campaign actually addressing the connection between HIV, TB, mental health issues, and other issues that, have been mentioned so far?
Yes. You should remember, as the Department of Health, we are not dealing with individual patients.
Yeah.
Or dealing with programs in isolation. We are moving from an integrated point of view. Yes. Identifying a holistic person. We want to treat a whole person. That being said, the interlinks between all of this is that we all know the connection that is there between TB and HIV. Obviously, those people who are having TB are most likely to have, HIV. Those with HIV are most likely to have TB because of the compromised immune system. But then again, when it comes to issues of mental health, which is important that you did raise, you should remember there are issues of stigma. Particularly the young people, they wouldn't want to be seen to be taking medication of HIV, to be taking medication of TB, and also their peers tend to stigmatize around them. So that's where now the mental health issues comes into play, where you find somebody being depressed because they cannot, seek openly support from their friends and so forth. But then also you should remember that we are in the academic space, which has its own, stressors based from your books, studying, and so forth. And then because of that, there are issues of, nutrition, where some of our students, you find that they are from, underprivileged families, and then they don't have the time to can actually take, proper nutrition while also on treatment. That also affects, the mental. So we want to address all of that. First, the element of stigma, but then secondly, to empower, young people to talk openly, but then also support each other on issues of, TB or HIV, but then also for especially boys' families to speak openly around, their stressors, their stresses, mental health issues, which is key, and it affects mostly, the male children or the boy children because of the societal, cultures that are there, the norms, the practices that are there. You are told that there's a boy, you can't cry and blah, blah, blah.
Yeah.
But we need to cry. There is a person maybe who is, a male here at the university who's on HIV medication. Sometimes you need the support of your friends, of your roommates. We need to empower them to talk openly.
The first point is
Finally, you talked about the fact that, the university is full of young people, technologies and stuff like that. Looking into this campaign specifically for 2025, are there any new tools, any new technologies or fresh ideas that are actually being introduced to the campaign to make it more effective?
Of course, the traditional ways of communication are dying. As you know, even the mainstream media, it's dying.
Yeah.
the emergence and proliferation of, your social medias, the new technologies that are there. So as the department, we are also aligning with this. Hence now we are moving away from giving, your normal posters, flyers that you will normally see. Now everything else you've seen, and that's when we were actually mobilizing for this, was done more using the new medias. So yes, we are doing that. But then over and above that, now coming specific to the TV program, we have, online platforms that we are using. Currently, we have what we call the My TV Story, which is an information sharing platform where we are encouraging people to share their lived experiences with TB, be it maybe people who have been on TB medication before and they were healed. Those are the people that we call the survivors of TB, or maybe the people who are just affected by TB because they simply with one of their family members. So this is the platform where you just upload, a very short video, maybe 5 minutes max, just sharing your stories, your experiences, or your journey with TB. The intention for that is actually to demystify certain issues, to provide facts, but then also to help mitigate the stigmas that are there. That's one. Secondly, we have, the TB self-check application that, you just go into your WhatsApp. From there, then you are able to screen yourself in the convenience of your own home. In the PT currently, I don't have the numbers. I wish you would have told me. I will share that number so that our listeners out there can use it to actually self-screen without necessarily going to clinics. We know that the waiting periods in our healthcare facilities can be long, which is a deterrent on its own. So we are using that to actually mitigate that. But then over and above that, we know that people use money to go to clinics, to go to our hospitals, particularly to test for TB at a clinic level. Now we have the SMS service, meaning that when you are at a clinic and you are tested for TB, we take your particulars. After we received your results from the laboratory, then the results can be sent to you, or an advice to say, hey, maybe go back to the clinic, or hey, you do not have TB, but then of course we encourage you to regularly check yourself. So there are those, technological, platforms or methods that we are using.
Yeah. You talked of issues pertaining the boy child, issues of mental health. But in closing, incorporating all of that with the hashtag and TB campaign for 2025, what is it that you can say to our students that are going to be watching this episode, to the people in general from the communities that are going to be watching this episode?
With that, I just want to be very direct to say the call to action is for our people, young, old, young, it doesn't matter, black, white, it doesn't matter. Please ensure that you regularly screen for TB. Please make sure that you test for TB. And for those maybe who have tested and have been on treatment, please ensure that you remain on treatment as instructed by the healthcare providers and ensure that you complete your treatment. That is the only way in which we can end, the scourge of TB in the country. So that is the most embedded message that we are putting across. I think that pulls together everything without necessarily repeating what I've said before.
Yeah, no. Mr. Silelia Marake, thank you so much for your time.
Thank you, Mewaka.
We are now joined by someone who works with students right here at the University of Venda on a daily. She's someone we consider a peer helper. Good day and welcome to the Univen podcast.
Hello, thank you for having me here.
Yeah, if you could please introduce yourself to the people and what is it that you do as a peer helper?
Okay, so I am Zoe Maluleke. If you don't know me already, I am a peer helper, a final year law student, and I am actually part of the HRC, so I'm also a blog rep.
Very interesting. So if we are to look into your title as a peer helper, what is it that you do at the University of Venda? as a peer helper?
Okay, so what we basically do as peer helpers is that we stand in line as your first friend on campus. We stand in line as the one person you'll be able to talk to when you have nobody to talk to. We aim to make sure that you take care of your mental health. Your well-being has to come first, and that is exactly what we prioritize.
So today we are at the University of Venda Stadium, and the event or the campaign that's ongoing here is called the hashtag and TB campaign for 2025. When you hear the word TB, what is it that comes to your mind, or what is your understanding of that?
Tuberculosis. It's a very serious sickness because it's similar to COVID actually. It's like flu but like on steroids.
Yeah. So if you are to look at the University of Venda students, do you think most students at Univen take TB or other health issues seriously enough, or do you feel like, there's still a sense of distance or stigmatization that still happens when we have to talk about issues like TB?
I don't think we take those seriously. I believe my generation of people, they couldn't care less about TB. They couldn't care less. Pregnancy. That's the biggest issue amongst us. And I think that's one thing we need to talk about because that's not the only problem we have. I mean, TB is a serious thing. And I don't think people even know that you can get TB on your daily life. Like, you can get it. And I don't think we are talking about it enough. We're not talking about it as much as we should. Since COVID left us, we're not talking about TB enough.
Yeah. So do you believe that such initiatives, the initiative that the Department of Health is actually hosting today, the AND TB campaign, do you feel like it can actually change how students view and respond to such issues?
Yeah, totally. I believe that this was a good initiative. We needed something like this. Yeah, I believe as the university, we don't have enough campaigns that talk about TB because we're usually pushing HIV.
Yeah.
So I think we need something like this.
Looking into young people, students, what role do you think young people, especially students, should be playing when it comes to raising awareness about TB or other broader health issues that, we experience here on campus or on our daily lives in communities that we come from?
I think the moment we stop being embarrassed about talking about these sicknesses, the more we're going to be able to talk about them and raise awareness. Because what's the point of us making all of this stuff and having these campaigns if people still feel humiliated to talk about these sicknesses in general while you don't even have it? So what good is it going to be if we're just talking about TB and people are not comfortable about actually talking about the treatment, prevention, and all of that? So I think there's a big wall that we need to break about being comfortable about talking about these things.
Yeah. As a peer helper, we talk about issues like stigma. What is it that you do with all the people that you work with to try to bridge in the gap with, different stigmas that people experience here on campus, be it about diseases or other issues in general?
We try to make people understand that should you be having one of these things, you're not the only one. And other people's opinions don't necessarily make anything else go away. So the mere fact that people think, ew, oh, TB, oh, ew, HIV and all of that, it's still going to be there.
Yeah.
It's still a global issue. It's still a national issue.
Yeah.
And there's nothing we're going to do about it. I believe the sooner we help people to become comfortable with these situations, the better, as I said before.
Yeah. In closing, I actually want your opinion on this one. What do you think can be done at the University of Venda? What more can be done to actually improve student health, student wellness, not specifically focusing on TB and HIV, other things like nutrition, access to student health right here on campus? What's your opinion? What do you think should be done?
Firstly, I strongly believe that we need to have I don't know if it can be a program or what, but we need to hear people's opinions. I'm glad you actually asked me that question because I might be having a lot of issues with the way health services are being provided on campus. And a lot of people might be having those same services, but nobody knows where to go. I think the sooner we know who to tell these issues and having these issues addressed, the better. Because making education fun is not enough. We can raise awareness, we can have campaigns, but it's not enough if the service delivery is not going to be equivalent to the way we were raising awareness. I believe we need to give ourselves time to learn, but in a way that will never be judgmental or biased or sound like a stigma. Because the sooner we realize that it's not just me, this is not my world, this is a world where we're all trying to coexist, the better. Because what help does it make if I'm just going to come to a campaign, come for food, and then leave? Did I learn anything? No, I didn't learn anything. You're just going to come here, eat, and then leave. So the sooner we try to make an effort to make it fun and make it to be something that's engaging. Don't just come and sit down.
Yeah.
Ask for opinions. Are the students satisfied with the way health services are being provided on campus? Are the students being satisfied with the way they get the services when they go to the clinic? Are they satisfied with the ambulance service provider? Are they satisfied with the amount of information that they get about these certain diseases and sicknesses that they encounter daily? Are they comfortable enough to seek help? Are they comfortable enough to go and be like, you know what, I'm not okay? Sometimes you don't need a friend you'll vent to because your friend might take your business to somebody else.
Yeah.
TB is not the only thing we're facing. Mental health, depression, people are suicidal. Well, you know that. You're not going to know everything. So I think those are things we need to make them. It's okay for you to feel like that, but it's not okay for you to be judgmental about it.
I think you've spoken like a real peer helper, a true peer helper. But in closing, what is it that you can say to the students that are actually watching this at this point in time? What is it that you can say, be it services around campus, or, what is it that we can do to get around campus, and face these issues in a better way?
I think all I can say is try to make friends. You will never know about the social issues that we face daily if you're on your own.
Yeah.
I mean, being an antisocial person is not a flex. I don't want to lie. It's not a flex to be an introvert. It's not a flex for you to say, I don't like people. You're not going to know about social issues if you're on your own. And you're not going to know where to seek help if you're on your own. Who's going to tell you about it? Because the work I do as Zoe Maluleke, it might not reach you because you're antisocial. You don't know anything. You don't know much. I believe we should go out there, be out there, make friends, and learn how to tackle social issues. You're totally going to get help.
Thank you so much for your time, Zoe.
You're welcome.